All right, so we're talking about prenatal visit checklist. You know, all right. So from hearing it, anytime you hear a concept, is good to actually try to like make sense out of it, try to break down it. So to me, this prenatal visit checklist is more of like, okay, a woman is pregnant, she's coming to the hospital for some checkups. So there are some things that should be checked and all of that. You know, so for this prenatal visit checklist, it's just things that should be discussed during what prenatal visits, like all right, it should be a must that they should be discussed during visits. So things that they should be always discussed during visits, that's during all those prenatal visits, include things like medical history. So medical history should be discussed. If the woman has had any previous medical issues, it should always be discussed and all of that. Physical examination, so thorough physical examination, you look at the woman's pelvis, all of that should always be examined. Laboratory tests, so all those blood workups for you are trying to dictate for infections, you are trying to check out for what the blood type, all right, and all of that should always be done. All right, then due date calculation, so you want to actually discuss the possible dates in which a woman is likely to give birth. So all of that should always be calculated. Now subsequent prenatal visits, you always check for the weight, blood pressure checks, all right, fetal heart rate monitoring, fundal height measurement, all right, discussion of symptoms, like is she having any back pains, is she having like some symptoms to vomit and all of that. Then prenatal testing, fetal growth monitoring. So all these things are things that you always take note of. Always take note of. All right. Then third trimester visits, that's like she's almost about to give birth, right? So as she's almost about to give birth, you also take note of some things, right? So group B strep testings, all right, you're trying to check if there's a possible infections with group B streptococcus. Discussion of birth plan, so you're trying to discuss the preparedness for labor and delivery. Preparation for parenthood, you're trying to discuss all those possibilities of what breastfeedings and all of that. I also want to monitor if complications could come up, you understand. So additional topics to discuss during all those visits is things like what nutrition and exercise, right, prenatal testings, if possible pregnancy complications will come up, all right. Then you also discuss breastfeeding options, okay, and the possible support that might actually come up. All right, so that's it for the prenatal visit checklist.